a Toronto team initiative is trying a new treatment to help people who are at higher risk of COVID-19. It's called social prescribing. Wikidopia now on how it works by redefining what healthcare means for some.
As a senior with diabetes, Brian Smith is at high risk of severe illness if he gets COVID-19. Worried after someone in his building tested positive, he went to a pop-up testing site and left with a prescription for deliveries of free, nutritious food.
It did address the lack of my ability to get fresh fruit and vegetables. It means that I don't have to dig into my limited pension income to do this.
Healthcare workers referred Smith to this Toronto nonprofit dedicated to alleviating food insecurity.
Same folks during the pandemic who are being impacted most as were impacted previously. And so this project is set up and is structured to try to help to provide support to those folks who are facing the most barriers.
The free produce is just part of a new program that uses hospitals, pop-up testing sites, mobile health teams, and other community partners to identify people with inequities that underpin poor health outcomes.
Bi-weekly food delivery for a limited period of time is not the solution to food insecurity, but what it does do is it allows people a little bit of breathing room.
When you're filing your taxes.
Breathing room that includes financial counseling for those with precarious or low incomes, a major risk factor for poorer health. Same with inadequate housing. Homeless people frequently end up in hospital, so workers try to find them a room. One of the program's architects says all Canadian hospitals should also rethink their delivery of healthcare this way.
To see these people as underserved, not high needs, not vulnerable, not being people who are frequent flyers as if they're trying to use and game the system, but acknowledging that the system has been broken.
The consequences of which Buzari says the pandemic has laid bare. Wikidopia, CBC News, Toronto.